Okay, so we're going to give Mr. Saunders his nebulizer for the day. So Penny's just going to assemble the equipment using the correct compressor for the drug given. So a gas source must be sufficiently powerful to aerolyse the drug, in which case the drug is ventolin today. So Penny's going to check the drug in the solution and... Yep.
Alrighty. So Jess is just going to be my second nurse for the demonstration. So in checking, we just need to check the 6 rights when giving a medication and if he has any allergies. Yep, so it's Jeff Saunders. Yep. Yep, MRN.
181920.
Yep, perfect. And do you have any allergies? And he says no. Cool.
Alright, so that's all done.
Yep.
Okay, so we've checked the prescription. Now Penny's going to get the nebulizer all organised.
Yeah. So with the nebulizer, we just put this back into the oxygen and just make sure it's secured tightly. Yep. And then with the drug, you just pop this part off like that. And this is the Ventolin.
Just check the date.
Check the date and expiry.
Yep.
Yep, and it's the right thing.
And the drug against the prescription?
Yep.
Yeah, we did that earlier. Alright, so when placing the drug in the nebulizer chamber, a minimum of 2 mils and a maximum of 4.5 mils should be used.
Alrighty, so that's all set and ready to go.
So before Penny put all the drugs in, we checked that it was all okay and there were no dust particles that were drawn into the nebulizer. Yes. Okay, so Penny will ensure that the patient is in an upright position and that the nebulizer is upright on the face. This is to maximise lung expansion and drug delivery.
Alrighty, so Mr. Saunders, I'm just going to pop this over your head. Yep, just like that. And just make sure it's tightly around the nose and the mouth to ensure no air escapes. Yeah. And he's sitting in an upright position.
Alright, so we're going to switch on the gas supply.
Yep.
In this case, we're going to use air at a flow rate of 6 to 8 litres per minute. This is to ensure adequate aerolysing of the drug.
Yep. And as you can see it.
Okay, so Penny will encourage the patient to deep breathe normally.
So breathe normally and take a few deep breaths every couple of minutes. And please don't speak.
Yeah. So with most nebulizers, 60 to 70% of the drug is wasted during the expiratory phase unless breath-assisted nebulizers are used, which this is not. So in this case, it's good to keep the mouth shut and not talk. Okay, so once that's all done, the nebulization, it will spit intermittently, or there will be no further aerosol to be delivered. So this will be no more than 10 minutes for bronchodilators.
And then we'll just take this off, Mr. Saunders. Thank you.
Okay, so Penny will disconnect the nebulizer from the tubing. Yep. And we'll use the compressor for a short period to clear any moisture in the tubing.
This is for take away the taste.
Okay, so this is to reduce any potential risk of bacterial contamination if moisture remains in the tubing. So Penny's going to clean it now.
Yep. So you just take the nebulizer apart in 3 different parts. So here's the first, and you just put it in warm soapy water. Here is the second and the third. And you just give that a good wash, and then you take it out, and you must leave it to dry, or dry any extra parts in paper towel.
Yep. Particular attention should be paid on the bore nozzle, which is this little thing up here. To ensure, because this can become blocked and the drug next time won't be aerolysed sufficiently. Okay, so you're advising to do this now?
Oh yeah, and because the drug is steroid, like like if it was a steroid. Just advise the patient to rinse their mouth and wash the face around where the mask was.
Because the drug can cause an irritation to the mouth or skin around the mouth.
But in this case, it's Ventolin.
Yep, so it's got steroids or antibiotics.
Yeah, but in this case it's Ventolin, so it's
Should
right.
be right. Yep. Alright, so the nebulizer will be changed every 3 days, or if it becomes contaminated with sputum, or if it's not working. This is to ensure clean functioning equipment is available. Yeah, so always make sure that the patient is educated well.
And cut.